So welcome. Whether you're a medical assistant at Ocala Eye or a technician in another practice, you are part of a fantastic profession. You help people see better on a daily basis and really make a difference in people's lives. I want to talk today in this series about glaucoma medications and different types of glaucoma drops. It would really help you a lot in your career to understand the different medications and what they're used for in terms of being able to sort out with patients reviewing their medications and also understanding perhaps some of the side effects from the medications. In general, glaucoma drops, the whole point of glaucoma drops is to lower intraocular pressure. The lowering intraocular pressure happens when the drop increases the rate at which fluid leaves the eye or decreases the rate at which fluid is made inside the eye. There are several different classes of glaucoma medications, and I'm going to go through some of them with you now. The most commonly prescribed are prostaglandin analogs. Prostaglandin analogs lower the pressure inside the eye by increasing the rate at which fluid leaves the eye, so they increase outflow. Examples of prostaglandin analogs, the most common is latanoprost, imadaprost, travoprost, you hear Xalatan, Lumigan, Travatan, Xioptan, all these different names that you hear, but essentially they're all prostaglandin analogs. And patients will typically describe using a bottle that you use to dose once at night, and it has a teal colored bottle. So that's one class of medications, the most commonly prescribed prostaglandin analogs are dosed at night. So a second class of medications is very commonly prescribed are beta blockers. Beta blockers will typically have a yellow cap. They are also dosed, usually just once a day, but in the morning. Timolol and other beta blockers lower the intraocular pressure by reducing how quickly fluid is made inside the eye. So they decrease inflow of fluid in the eye and thereby lower pressure that way. So we've talked about prostaglandin analogs, we talked about beta blockers. A third class of medications are alpha agonists. And these are alpha-GAN or brimonidine. That medication lowers intraocular pressure by also decreasing the rate at which fluid is made inside the eye. And that is dosed typically twice a day, sometimes 3 times a day. A fourth class of medications are carbonic anhydrase inhibitors. These are the ones that are going to have an orange top. The two most common are dorzolamide and brinzolamide. So that's another class of medication. They also decrease the rate at which fluid is made inside the eye. Another class of medications are Rhopressa. Those will typically have a white cap, and they're called Rho kinase inhibitors, and they work by increasing the rate at which fluid flows through the trabecular meshwork, so increasing the rate at which fluid leaves the eye, and so improving the outflow of fluid from the eye, thereby lowering intraocular pressure, and those are dosed typically just at night. So we've talked about 5 different classes of medications today for glaucoma: prostaglandin analogs, beta blockers, alpha agonists, carbonic anhydrase inhibitors, and Rho kinase inhibitors. If you can memorize those 5 classes, it will go a long way in terms of helping you understand the different types of glaucoma drops, what they are and what they're used for. And as new drops come out, you figure out where they fit into those categories over the years. Thank you for watching, and good luck.